broke my leg, tore my meniscus in 1973 skiing, and it was never the same. And it just kind of wore out. Orthopedic surgeon said that, he said, you haven't just worn out the tread, you're on the rims, and you're shooting sparks. And so I was scheduled for knee replacement on November 18th. I was to the point in my life where I couldn't stand the pain anymore. And it takes a lot for me to get to that point. I just pushed through it. I didn't want to have surgery. I was totally against it.
Stem cell is the future of medicine. If you can imagine a cell that can become any kind of tissue in the body, it can become joint tissue, muscle tissue, ligament tissue, heart tissue, kidney tissue, whatever dysfunction or whatever it is that you need to repair, stem cells can become that. And by introducing stem cells, you then regain that potential in order to be able to regenerate that tissue. When you deal with any kind of pain, cortisone is what's commonly used to medicate that pain. Repeated injections will actually leave that area weaker than what it was when you started. Stem cell therapy does the complete opposite. And what is fascinating with stem cells, it is able to travel to the site where it is needed. So even if you would inject it in the vicinity of where you need repair, it will then travel to the area where it is needed the most. The stem cells we used are from a healthy pregnancy. So you can use either the amniotic fluid from that healthy pregnancy, or you can use the umbilical cord blood.
I don't have any pain in my knee. It's safe, it's fast, and it stimulates your body to fix itself. If you're contemplating any kind of surgery, it's worth it, you owe it to yourself to do stem cell first. You can always have the surgery, you can always have a knee replacement, you can always go back and do that, but if you don't do this first, then you're shortchanging yourself, because at least give that a chance for your body to heal itself.